Hey everyone, welcome to the LA Doula's doula training video, and this one we are talking about how to navigate a birth room. All right, so you're here. It's your first doula appointment. Are you freaking out? Don't freak out. It's good that you're there. She needs you. So it's not as hard as you think. And then it's also a little bit harder in places you probably didn't think about. So we got to make our birth bag. You want to make sure you have this ready. Go to your prenatal appointment pack. You'll find what to bring to birth, the best birth bag. So it's broken down into categories like birthing assistance, and this is something like birth balls, peanut balls, rebozo, which is a scarf that you can use during labor. Environment, so things like essential oils, battery operated candles, Christmas lights. It really makes all the difference to change the environment, and that's one of the first things that I do when I get into the room. Tech, things like your camera, your phone, your chargers. Food and drink for yourself and the mom. I always like to bring honey sticks for the mom and straws for the cups, because often they forget their water bottles, but also the cups at the hospital don't have straws, and mom is having a hard time lifting her head in labor. Things like mom self-care, so hair ties, face wipes, chapstick. You know, it seems a little extra, and why isn't she bringing it herself? But it just makes you that more better of a doula to have these things with you. And then for you, make sure you have a sweater, a sleeping pillow, socks, a Kindle if she does get an epidural and she's sleeping, so you have something to do in the waiting, your charger, and your phone. So that list is in your prenatal appointment pack. So you've got your birth bag. Now what? She calls. Do you go right when she's in labor? What if she's going to be in non-active labor for 5 more hours? The best bet is wait until she's in active labor. This is when she's in labor land, we call it. She can't really see, she can't really think, she can't text. When she stops texting you and it's her partner, then it's probably time to meet up. So meet her at her place of birthing, and right when I get there, I sort of assess the situation, check in with mom, check in with partner, see if they need anything immediate, and if not, I start setting up the room. So usually they haven't had time to set up their essential oils, set up their fairy lights or their candles, turn off the lights, because usually they don't realize that they can darken the room, and you're creating that environment. You're getting the music on, you're bringing a peace. Then see if mom wants to get into the shower. I found, especially if she hasn't got an epidural, that the best thing to do to bring her back to that zen place is get her in the shower. You can put the essential oils in there and create almost like a spa and the music. Also, she's standing upright, which helps baby to move down. Have her birth plan on you yourself in case she forgets it, and you can share it with the nurses. If she doesn't want to get in the water, then get out a birth ball, get her bouncing on that ball, or get her on the peanut ball. Just get her comfortable, but these are techniques that she probably hasn't pulled out yet. If she doesn't want to do the birth ball, then you can move on to pillows and get her in a comfy position on the bed. Next, find where washcloths are so that the husband or the partner can grab them and help cool her head down or put essential oils on. It's good to kind of take an assess of the room and just sort of find where things are in drawers. Don't be intimidated. Go for it. You know, you are there, and most of the time the nurses are excited you're there to help them. If you do get a nurse that you are not getting along with, or the mom is not getting along with, unfortunately for you, you might just have to suck it up. But if the mom is not getting along with her nurse, she has full reign to request a nurse that she will get along with. This person is taking care of you most of the time, and so you want to make sure it's somebody that your client is really in sync with, or at least can tolerate. So the doctor doesn't come in until she's pushing most of the time. You might get a check here and there, but don't expect the doctor to be in there a whole bunch. It's usually just the nurses. They come in and check periodically. They're going to be checking the monitoring, and it goes back to your birth plan. If she wants intermittent monitoring, then what? She's going to be off and on those straps, and you're going to really be the guardian of her monitoring, because if she does want to take those off, you could help her out with that and let the nurse know. And in the meantime, you're really just being present with the mom. Here's the difference between you and everyone else. You're not leaving her side. You're breathing with her, even if you have to breathe in and out 100 times. Even if all you do is sit there and hold her hand and help her breathe, that is being a doula. Please don't think you have to be doing headstands and, all these amazing massage techniques. In fact, most moms don't really want to be touched when they are in labor. But just knowing you are there and you know what you're talking about and that there's another presence in the room that is there for her, it's going to make all the difference in the world. Some other things in the room, there is the panda warmer for the baby. It weighs and keeps them warm. There might be a chair or a bed for the partner to sleep on. And of course, we always have a shower or a tub in most rooms. Take advantage of these things. Sometimes you might want to even sit in that chair and just sort of do a rocking chair sort of movement. Once it's time for baby to come, then the doctor comes in, and here's when things can get a little hectic. A lot of people come in the room at this time. Sometimes we've got the pediatrician in there, other training doctors and nurses. I mean, you really have got to connect with mom at this time. When she's ready to push, help her to get into the position that she wants to push in, and then be there by her side. Just don't leave her. There's going to be a lot of people. It gets chaotic. There's lots of lights, and this can really throw mom off. Pushing is a lot of effort, and there's a lot of people staring at you when you're pushing. It's really good to make eye contact with the mom during this time and, just let her know, I'm here for you, I'm here for you. And you're going to help her with her breathing techniques. You're going to help her know maybe when to bear down and push down. It really all depends if she has an epidural or not. If she has an epidural, she's not going to be able to feel when it's ready to push, and so you guys are kind of watching the contractions on the monitor together and encouraging her when it is time. Once baby is there, help mom get baby onto her chest if she's having a difficult time. Let her know and encourage her it's okay for baby to latch on at this time. We're not talking about breastfeeding. We're just talking about that golden hour where baby's hanging out on the breast and mom is loving on. Your client might be getting stitches or delivering her placenta. Sometimes this can be painful. So again, it's good to be there with mom, keep her distracted, talk about baby, love on baby, and maybe explain to her the things going on in the room. Sometimes when we know what's going on, it helps us to be a little bit more peaceful. They're putting your placenta here, they're getting ready to do this, a quick shot here to numb your vagina for stitches, just kind of giving her a play-by-play so that she can focus in on baby. I usually hang out for about an hour or so after birth. I take some Polaroids, I make sure there's anything else that they need, and then I let them carry on and start their new family. So if you are intimidated about anything specifically out of birth, go ahead and DM me or send me an email and we can talk about it. But really, most of the time, a birthing person really just needs you to be there by their side, and knowing that you're there is enough. So don't feel intimidated. Learn your interventions. Learn when you might have to step up. If mom doesn't want an episiotomy, if mom doesn't want suction, if mom doesn't want the baby bathed, these are all things that you've got to know and sort of protect and guide as the doula. You and the partner should have a language together where you can stop things from happening that the mom doesn't want to happen. Hope this helps you to navigate your birth room, and I will see you in the next video where we talk about all the different ways you can expand your doula business if you want to do more than just be a birth doula. Thanks so much.